I'm Nicole Walters. In Section 4, I will be demonstrating IV administration via medication administration via minibag. I will first check my doctor's orders. My doctor has ordered vancomycin. This is an antibiotic that binds to bacterial cell wall. It's bactericidal. It's used in severe systemic infections such as MRSA. It's used with patients allergic to penicillin. The recommended dose is 500 milligrams every 6 hours. The side effects are red man syndrome, ototoxicity, nephrotoxicity. Contraindications are allergy to the drug if the patient is taking aspirin, aminoglycosides, or loop diuretics. Nursing implications are the whisper test for cranial nerve number 8. You would check renal function and culture and sensitivity before your first given dose, and this is my drug card. Its time to be infused is over 60 minutes. I have a 50 ml bag of saline, and tubing with a drop factor of 10, so my rate will be 8 drops per minute. My doctor has ordered 500 milliliters. My doctor has ordered 500 milligrams of vancomycin to be administered every 6 hours, and I have 500 milligrams per milliliter available, so I will administer 1 ml of vancomycin into my saline. I will first, to do my hand hygiene, I will clean off my medication bottle. I will now draw up a milliliter of air, put it into my bottle, take my milliliter of vancomycin out. I'm gonna insert it into my bag. That goes the sharps. I'm gonna gently mix my medication, and I will label my bag with my initials, the drug, the dose, the rate, the date, time it was given, the route it was given, and I will now attach my tubing and I will be very careful not to contaminate this bag because it is sterile. Untangle my tubing. So I am attaching my tubing, making sure my tubing is clamped off, hanging my bag, and as I'm checking my doctor's orders, I would have also checked any patient allergies and lab work. So now I'm going into my patient's room. I'm introducing myself, doing my hand hygiene, checking their name badge, name band. I'm asking for 2 identifiers. I'm gonna check their sites, make sure there's no redness, any phlebitis or infiltration. I'm going to I would have my gloves on. I'm cleaning. I'm cleaning their IV site, their tubing, and I'm attaching 6 milliliters of normal saline. I'm going to aspirate. I've gotten blood return, which means I'm in the vein. I'm going to push pause. I would have had this unclamped. I'm aspirating. I'm going to insert 3 milliliters of saline. Push pause, push pause. Going to unclamp. And I would have primed my tubing, and I would have double checked any allergies with my patient as well. I'm going to unclamp. I'm going to prime my tubing. Gonna unclamp it. Priming it. Not letting too much come out. I would not have let that much come out. I'm going to, now I would clean my patient's site again. I would attach I would have clamped my tubing back off. Now I would be unclamping it. I would be unclamping their IV line. Now I'm going to establish my drop factor of 8. I'm checking my 4 Ps. I'm making sure they have had no type of reaction. I'm going to come back. This is infusing over an hour, so I'm going to come back in an hour, make sure my medication has infused. I'm going to make sure no reaction has occurred. I'm going to check the patency of their line again. I would clamp this off with, and I would have labeled my tubing with my date, the time, and my initials. I'm clamping this off even though it's infused. I would put a fresh alligator clamp on there because it's good for 24 hours. I'm going to attach my saline, unclamp their IV line, and I will aspirate for blood return. Means the line is still patent. I'm going to push pause the rest of my saline, my 3 milliliters of saline in there. Now I will clamp off their line. I would have clamped off my line before I attached my syringe. Now I will double check for any type of reaction, check my 4 Ps. I will document the time, date, dose, and drug, the route, the site condition. This is my documentation card. I will dispose of all my needles and syringes. I would have disposed of all my needles and syringes before I documented. And that's all.